Welcome back to Perception Paradox, where we explore the minds of innovators and the stories behind their success. Today, we have a special guest, John Klepper, the CEO and co-founder of PIPRA, a health tech company revolutionizing preoperative risk assessment. John shares his unique journey from the film industry to tackling some of healthcare's biggest challenges. We delve into his entrepreneurial mindset, the importance of co-founders, and the critical role of innovation in improving patient outcomes. Get ready to be inspired by this conversation. Real people, real stories, and real challenges that break the status quo. I'm your host, Živile, and welcome to Perception Paradox. Hi, John. Welcome to Perception Paradox.
Nice to be here. Thank you so much for the invitation.
Nice to have you here. Finally, we made it. And yeah, John and I, we've been bumping into each other during the conferences, and we were like, had a matchmaking meeting at Slush, and we're like, yeah, I think we should do a podcast. Yeah, we should. So here we are. It's really good to have you here. So how is the holiday season for you going?
How's
The holiday season going for you?
I don't know yet. I put up a tree.
Oh, that's great. That's a good start.
That's about it. I had
Amazing.
had a couple of Christmas dinners, but it doesn't feel like the holidays have yet started because it's been pretty intense lately.
Okay, I think we're gonna dive a bit what we've been working on, but first things first, I do like to start the conversation usually with guests from early beginnings, right? Even previously when we met, you shared a bit about your very diverse background, from working in films to working with neuroscience. Right now you're building a company within health tech. Tell me, how did this whole film career, and film is all about the storytelling, creativity, a lot of engagement. How do you see this transition into entrepreneurship from film industry, and how did it help with your business?
So yeah, honestly, I didn't start off thinking, I'm gonna be an entrepreneur and this is my path in life. I was an artist. I went to art school and painted, sculpted, and worked as a professional photographer for a while. And that was my career path. And then I got really excited about film. I went to film school in Los Angeles, and while I was doing my master's, one of the teachers that I was working with said, "Hey, I'm thinking about starting a production company. Do you want to help me build it?" So I was like, sure, it sounds great. I have no idea how to do that, but let's figure it out. So then I was doing my master's degree in parallel to starting a business, and that was a bit challenging, but also super exciting. And it was just kind of figure it out as you go. And he had some experience previously with entrepreneurship, so I learned a lot from him and from the team. But yeah, it was very much a case of just figure it out as you go and make a lot of mistakes. I think a lot of those mistakes help you become, a better entrepreneur. So that was the beginning. Then I decided to move back to Europe, and I had an opportunity to build a production company in Europe, in Sweden. Yeah, and then again, there was this opportunity to sort of take over what I had built for another company and to kind of run it myself. And having already sort of done that once, I thought, I think I might be able to do this by myself. So I was the sole founder at the time. I don't recommend that. I think having a co-founder is very beneficial if you find the right one. But the company grew and it was very successful, and I ran that for about 6-7 years before exiting and starting my next project. So
Okay.
entrepreneurship wasn't planned. However, the mindset of an entrepreneur is, I think, something you can learn, I guess, but I think it's maybe a bit more those people who are constantly looking for a better way, a solution to a problem, and it's just constantly present in your mind, right? So anywhere you go, anything you do, you're looking at things from a slightly different lens where it's like, I think there's a better way to do that. And then you're going further and like, what is that better way? Oh,
Yeah.
it would be so much better if so when I'm with entrepreneurs, I'm constantly hearing them saying, why don't they do it this way? Why don't they build this thing? It would be so much more efficient, right?
That's a constant kind of, I don't know, TV radio in your head where like, you could do this better, you could do this better. How can you do this?
Yeah, I mean, a lot of entrepreneurs have something like ADHD or dyslexia or some kind of challenge that from an early age they've had to push through to kind of find other ways to get to the goal, right? I was dyslexic when I was younger. I say was because I somehow ended up overcoming dyslexia. But it was very, very challenging as a kid growing up. And one of the things that I had to do, and I've learned that a lot of entrepreneurs who have dyslexia or ADHD or other things that they have to struggle with a bit, teaches them to persevere, to keep pushing, to find a way that may not be like the straight path that most take. And that also, I think, creates a mindset where you are relentless about trying to get to the end goal or to the solution.
What would be those key traits of the mindset? Because we speak a lot about entrepreneurship. It's all about the mindset, about the attitude, resilience. So from your experience, what are those key traits that makes, I would say, a successful entrepreneur or someone who does not give up when the things get hard?
I think, there's a lot of things that we talk about that I'm sure we all know about like, being passionate about something that you feel a deep desire, a deep need to want to solve, to want to fix, or to want to make better. And that combined with resilience and just having this drive that pushes you where maybe others would just say, this is too difficult, or it's just not worth it. You just, you go that extra mile. And then part of that is just driven so much by the passion, by the want to make the problem that you're trying to solve solvable. And I think there's a lot of creativity in entrepreneurship because there's so many things that you need to know that you don't know. And you need to find creative ways to solve problems and to find solutions. So in some ways, I think that my earlier career in art, that creative side, has definitely helped as an entrepreneur.
To kind of think outside the box and to find different neurons and ways to actually get to the destination. That's so cool. And you mentioned a bit about the problems and the way you've got into the businesses as kind of seems a bit of a serendipity, being in the right places with the right people, and then just started collaborating with them and working. But I've been part also of some acceleration programs. I've been working with many founders. A lot of people, especially in the last few years, I want to be an entrepreneur, I want to build a business. A lot of focus on the venture-backed entrepreneurship as well, which is not the only way to build business. But many of the people I found they do face the problem of, how do I find the problem worth solving? And everyone gets into this limbo. They have an idea, but that idea not necessarily solves a big or impactful problem. So how did actually you find your latest problem to solve? And what's your process of deciding when a problem fully deserves your attention?
Yes, that's a good question. So I think, it goes back to what I was saying just earlier, which is the entrepreneurial mindset. It's not... If you just sit down and you're like, okay, I want to be an entrepreneur and I want to find something to solve, right? Then I think that's going to be really challenging. It's not to say it's not possible, but it's going to be very challenging. Versus to me, what I see in successful entrepreneurs is this looking at the world through this different lens of constantly trying to solve problems, constantly trying to look for better solutions to anything and everything. And through that journey, you find something that you're like, wouldn't it be better if this, and suddenly it resonates and you're like, or you grab onto it, or you feel emotionally attached to it, and you're like, I want to solve that problem. I don't think it comes from just sitting down thinking, what is the problem that I'm going to solve? It's more just going through life and coming across various different things that need solving and finding one of them that you identify with. Now, that can also be, another way is one of your co-founders has come up with that problem, right? And you, in talking to them, identify as well with that problem, and you think, this is something I am also passionate about and want to help you solve. So it doesn't necessarily, have to stem from you. But more often than not, I think entrepreneurs will, in their journey and their various different startups that they'll often do, there will be at least one or two of them that will come from their own imagination, their own idea. Does that make sense?
Yeah, it does make sense a lot, actually. And again, entrepreneurship teams. You kind of a bit said that you also did a solo business. So why was it difficult for you to build a company alone? And why do you recommend to have a co-founder?
Being an entrepreneur is very difficult, right? That's not a secret. It's very, very challenging. It's very lonely at times, even when you have co-founders. You're constantly being hit with no's, right? Because you're usually trying to solve something that hasn't been solved before, or an approach that's unique, right? And so you're pushing a rock uphill. I'm sort of looking at pictures in the background there and people walking up or something like that, right? It's like
exactly.
That's it, right? You're doing a very, very difficult thing, and doing it as a solo founder is challenging because you don't have somebody to just be like on that equal level with and just say, hey, I'm having a really tough day, or I can't figure out how to solve this, or what do we do next, how do we figure this out? Not just because of the emotional support that co-founder can offer you, or co-founders, but also because they can have ideas that you don't, or just talking out loud with them can bring the solution. It's also really beneficial to try to find a co-founder or co-founders who are, who create a multidisciplinary team, like who have a different background to what you have, so they can look at the situation, the problem, from their own lens, their own perspective, which you may not think about. In my current team at PIPRA, I have two co-founders, amazing people. One's an anesthesiologist, intensive care specialist. So she comes from things, very much from a lens of the patient and health, and how do we build what we're trying to build and make it fit into the clinical pathway so that the clinician will want to use it? And at the same time, how do we ensure that the patient receives the care and we're not harming them, right? We're actually doing good. My other co-founder is a cell biologist, a scientist, and he's also our CTO. So he has a very pragmatic approach to things. He's very structured. He's very analytical. So very good at the data science, and his approach, brings another lens, another perspective, right? And mine are much more from the business side. I bring a different lens as well. In some situations, we need to. The medical side makes perfect sense, but from a data perspective, it doesn't, right? It's too costly, or it's too expensive, or it's going to take too long, or whatever. Some other problems might not make sense from a data perspective, but from a business perspective, it doesn't make sense, So like we challenge each other, we talk through the problem, and then usually we find, a consensus.
And how did you find your co-founders?
So Nayeli, the anesthesiologist, I met through clinicians at a hospital here in Switzerland as I was trying to discover more about the problem. Happy to tell you about in more detail. One or two of the clinicians said, I think you should meet with Nayeli. As an anesthesiologist, she'll be deeply aware of this problem. And we met, and we had a great mutual shared interest in the problem. And we got along really well, and we just sort of decided, let's let's look into this a little further, and see if there's really something there. Let's do some discovery, and let's talk to a few more clinicians, and let's look for some money. And on that path of looking for money, we applied for a grant from the European Institute of Innovation Technology. And it's a pretty large grant, which they give out 2 grants of this size every year to 2 companies throughout Europe. And on that path, we met our third co-founder, Ben, who was looking to join a team. And it was a perfect complement to what we were missing. So that was the beginning. And we ended up several months later winning that grant, and that was the beginning of PIPRA.
That's a great beginning. So you already put some teasers out there. So what are you doing with PIPRA so the audience can learn? Because that's a big problem you're solving. It's not a very widely discussed problem. From my experience, maybe I can be wrong, but we would like to hear what led you to this problem, and how are you changing now this whole health tech world?
So PIPRA is a company. It's based in Zurich, Switzerland. It's working in neurocognitive diseases, using machine learning to predict, prevent, and diagnose disease. We are starting in a specific disease area called delirium. Delirium is similar to dementia in that you have confusion, disorientation, memory loss, agitation. There's a lot of very similar traits. One of the big differences is that it's much more acute. So it's very often triggered by a specific event, like a surgery, for example, or a fall, and person will change from one moment to the next, from their normal state to a state of delirium, which for many patients describe it as the most terrifying experience of their life, because they're so confused and very often hallucinating, seeing things that aren't there. And they're somehow aware also of where the fact that this is all going on, and they remember it. It's just, it's an awful disease, and it has very serious long-term consequences. So patients who get delirium, their risk of ending up in a nursing home within a month goes up 600%.
That's a huge number.
Of getting dementia within a year goes up 1,400%. 25% of patients die within a month. But it's a very serious problem. It has a very high incidence, which is also crazy because little to nothing is being done about it today. The incidence in patients over 60 is 23%. So nearly 1 in 4 patients over 60 will experience delirium. So when I discovered this problem, I was working in Alzheimer's disease, and I was interviewing clinicians to find out if hospitals could be buyers, could be interested in solving the problem. And they kept talking about delirium as a major problem. That dementia wasn't so much a problem for the healthcare setting, for hospitals in particular, because it happens slowly over time. It's very slow progression generally. Mm-hmm. Whereas delirium affects patients while they're in the hospital. And they end up staying much longer in hospital, and they need a lot more time from nurses. The costs are extremely high to hospitals. And it's not treatable. So once a patient gets it, the only thing hospitals typically do is sedate the patient. But that doesn't make it better for the patient. Sometimes it makes it worse. So the reason why I started PIPRA together with my co-founders is because we learned early on how big this problem is, how unmet the problem is, how devastating it is for patients, but also that it was preventable. And the challenge with the prevention is that preventive measures, while highly effective, they take a little extra time, and that's something that healthcare professionals don't have. So we thought if we can find algorithms that can highlight which patients are at risk on admission to hospital, then we can tell them which patients to focus on. And that would allow for the time needed and the cost effectiveness of spending that little bit of extra time on those specific at-risk patients. And so that's what we did. And so far it's been an amazing journey. We have a CE certified device. It's a medical device. It's just being deployed now into the market, and we're having amazing results, saving 2.5 million euros per 1,000 patients, reducing the incidence significantly.
How does it change the hospital percentage of prediction and saving the patients?
So by highlighting which patients are at risk, we're essentially saying, focus on these patients. They're the ones that are most likely to get delirium.
Yeah.
And so you're investing a little bit of time, additional time, preventively, right? In the balance, what happens is you end up reducing the incidence of delirium. So patients are not staying as long because there's less delirium. They are not requiring as much attention from nurses. A patient with delirium, on average, will take around 58, 60 hours of nurses' time when they're in the hospital. A patient without delirium is around 17 hours for a surgical patient, for example, on average. So it's a massive difference in workload as well. And that part of the value that we bring is reducing workload, reducing stress for the healthcare professionals, and improving outcomes for the patients and relatives. Saving lives.
Exactly, saving lives as well. So you developed a device, and that device is being used by the hospitals, right? That helps with artificial intelligence to track some kind of, not sensors, some inner, I don't know, whatever. What does AI track actually to see if that person is prone to delirium?
Yeah, so we look at, there's a lot of risk factors. We found the 9 most predictive risk factors that are routinely collected. And what I mean by that is we don't want to change standard of care if at all possible, right? And standard of care is generally, for example, for a surgical patient, that they will have a pre-anesthesia consult before their surgery. During that consult, the anesthesiologist will ask them a bunch of questions like, what kind of medications are you taking? What's your history? Blah, blah, blah. And they'll enter that information into their electronic health record. Some of that information, there's a lot of information that gets put in, and some of that information is relevant to our algorithm, is predictive of delirium. And some of those things include age, for example. Age is a big risk factor, right? We don't look at patients under 60 because typically delirium affects patients over 60. BMI, a lot of questions around history. There's a blood biomarker in there, CRP, which is inflammation. Delirium causes or can be triggered by inflammation. So where you have a large surgery, for example, if you have a hip surgery, you have a lot of cutting, there's a lot of inflammation at the local site, and some of that becomes systemic and travels around your body, crosses the blood-brain barrier, becomes neuroinflammatory, and creates this delirious state. So we look at these different risk factors, we extract them automatically from the electronic health record. So it all runs automated. And then it calculates the risk in percentage and also stratifies the risk into risk groups from highest risk to lowest risk. Then writes that back into the electronic health record, what the risk is, and informs all the healthcare professionals they need to know throughout the perioperative setting, throughout the hospital stay. And then tracks and monitors what's being done about that. So is the compliance high on screening to see whether a patient is actually getting delirium or not? Is it high on prevention? Are they doing the right steps or not?
So then they can take extra care and extra caution.
Yeah. So, and then being able to show dashboards that report what is the outcomes in terms of reducing length of stay, nursing hours, incidence of delirium, falls, infections, all these other things that can result from delirium. So it increases readmission rates. It has lots of knock-on effects.
Wow, that's wild. And how is it to work with government and public institutions? Because we all know it's very systemic and it's pretty difficult to get your hands on partnerships. The sales cycle seems to be very long.
Yeah.
As well.
Yeah, it's a very, very difficult sector to work in. Hospitals are in the business of saving lives, and And their clinicians are doing amazing things, and often under extremely stressful situations and long hours and often understaffed. So a lot of compassion for what they do. Having said that, there's a lot of talk around innovation and wanting to improve. Hospitals would benefit greatly by trying to figure out, how do we remove the roadblocks for innovation? How do we help startups work with us? How do we make it easier for them so that they can make it easier for us? Because while the big medtech giants like Medtronic and J&J and whatever, Abbott, while they're all doing amazing things, some of the really big changes happen from startups. Mm-hmm. And they don't have the cash flow to have tons of sales reps and have amazing presentations and have all of the relationships and the power to influence and to get in. And so they have to figure out, how do we get into these systems that are incredibly difficult to change? And there are some hospitals that have innovation departments where their job is to help exactly that, to help find really cool startups doing really cool innovative things and help them get into the healthcare system. But even hospitals that have innovation departments, those departments struggle because there are so many different stakeholders that need to buy in, that need to agree, and it becomes very bureaucratic. So in our case, for example, we have to convince the anesthesiologist, for example, that department that using our solution is going to be seamless. It runs in the background and it's no extra work, right? And what the benefits are. We have to convince nursing staff that the preventive measures are going to actually reduce time from them, right? We have to convince IT department that the integration is actually easy and it's going to be able to integrate. We have to convince administration that they're going to save money, right? And how they're going to save money. And collecting evidence to show that all of that is possible generally means clinical studies, which take a lot of time, very expensive. Then you have to wait for the publications to come out. Being able to develop the technology that can be used by the hospital legally means you have to go through regulatory pathways and get certification most of the time. It also takes a long time, right? So you need, as a startup, you need capital from investors who understand that it's a little bit of a longer journey. But on the flip side, if you can get through those barriers and you can start to get some initial traction, then things can really start to scale because hospitals are often part of big groups, so they can push internally. You can move from hospitals to insurances. Mm-hmm. Once you start proving that it works in hospital, then insurances often get interested. Then you can start to scale in a much more exciting way. But it's a little bit of a longer journey than a typical B2C or even a B2B in a different type of industry.
Yeah. Sounds like that. Are you already now in that? Sorry, go ahead.
No, you're solving real problems that affect lives in significant ways. And if you can do that and make a lot of money and returns for investors at the same time, then that's awesome. But it's very challenging.
I can imagine. And how is the funding situation right now when it comes to the health tech? Is it difficult to fundraise?
It is. It's a difficult climate at the moment to fundraise. I have a pretty large network, and I speak to a lot of entrepreneurs, and it's pretty consistent that I hear that they're having a hard time raising. Things are starting to turn, so I can feel like there's now some more capital being released, but it's been a very slow couple of years. And part of that is because there haven't been any big exits in the digital health space, medtech space. So those drive and fuel, brings new money into the investment world, which can then filter down to the startups. There's more appetite from investors in the sector because of these, big billion-dollar unicorn type exits. So as soon as a couple more of these start to filter in, then the landscape will change again quite significantly.
Well, that's also. So right now, what excites you most about PIPRA and this whole journey? What are your plans ahead with the company?
So we're proven that what we've created works, that it can save millions, that it can help improve patient outcomes. Now we want to do that at scale. So this is the exciting part where we are building relationships with hospitals in different countries. We have 3 hospitals in Spain that want to deploy PIPRA in their hospitals, in major hospitals in Madrid and Barcelona. We have 2 hospitals in Germany. We have 2 hospitals in the UK. We have a hospital in Belgium that's using our software at the moment. And in the United States, it's we've just done a pilot at Stanford. Mm-hmm. As we look towards the end of next year, we want to start looking more aggressively at the United States as probably our main market. Mm-hmm. So it's an exciting time because, we've spent a lot of time building evidence, showing that, well, first of all, building a product that works, getting it certified, proving that it works in hospital, doing the clinical studies, getting the publications. So now we have all of these things. Now it's the exciting time where we get to bring it to market. How
long did it take you to do this all? Like 6 years?
It's almost 5 years.
5 years. Okay, so that's quite fast, actually. Cool.
It's for this field, yeah.
Exactly.
Yeah.
Nice.
It doesn't sound like it, but it is.
I know. And so if you look back through your entrepreneurial journey, which is really exciting, and it's fascinating to see you moving across so many different industries when usually in human nature we're in general afraid to make a change. And here it's not only a change, it's all connected through entrepreneurship, but different industries, different problems, and now you're working on a very big one and complicated. If there would be something you would do different along the way, would it be anything you would actually different, or you would just keep the same journey?
It's a good question. I think if I had done things differently from the perspective of more knowledge and so making less mistakes, I think you need to make those mistakes sometimes in order to really, because people can tell you don't do this, don't do that. But then if you actually live it, if you actually go through it, like when I hear from other entrepreneurs about some of the struggles that they've gone through, they're never going through that again, they're super aware of don't go there, don't do that. I did it was a nightmare. So you can get some really good insights, advice. I think one of the things that I probably would have done is talk to entrepreneurs more. Mm-hmm. I know that when I do, I get often some little gold nuggets, things that, it took them 2 years to figure out. And you can save that over a coffee and you're like, oh, that's a great idea. Amazing. Why didn't I think of that? So probably talk to more entrepreneurs and maybe make a few less mistakes. It's good to make mistakes, but...
But then we can avoid, I guess, making those mistakes, right? By talking to more people. And I guess another thing that we're really bad at if we are building something, asking for help. Some people are really good at this, but sometimes we're also very bad at asking for help, for guidance, advice, and so on. Okay, pretty cool. So we're getting closer to the end. And I have this tradition in the podcast where I ask my guests to leave with a question to ponder through the day for the audience just after the episode. What would be your question for the audience?
I guess since this is very much about entrepreneurship, the question would be, when you get up in the morning and you think about your day, are you excited? And are you motivated, right? And of course the answer is that it can't be every day, yes. It's impossible. But more days than not, are you excited to start your day and to do what you're going to do? And if the answer is no, then maybe start thinking about something else.
A great way to end this episode. Thank you so much, John, for joining and for sharing your journey, for sharing how you're actually saving lives. All the best with your big plans for this year. And ladies and gentlemen, thank you for listening. It was John from PIPRA, and I will leave the links in the podcast episode. So thank you.
Thanks so much.